The PACE team also pays close attention to the needs of full-time caregivers like Bonnie Jensen. Her husband Stan suffered a stroke and lost the use of his right arm and his ability to speak.
I was getting pushed to a place where I don't think I was a very good caregiver. I got to be kind of grouchy, and I was crowded. I had all these decisions and all these things I had to take care of, and there just weren't enough hours. And now I have people helping me, and I didn't think there were people to help me.
That's a lot of what I do with her, is talking to her, affirming that she has needs as well as Stan, and helping her feel more comfortable meeting her needs so she can meet Stan's needs too.
The PACE program is financed by pooling Medicare and Medicaid funds. Participants not eligible for Medicaid pay part of the cost privately. PACE receives these funds as a set monthly per person or capitated payment.
You have to make the tip of your tongue go up behind your teeth. La.
In return, the program assumes full financial risk and provides whatever services are needed, including those that Medicare and Medicaid may not cover. For example, in other settings, physical therapy usually stops once a person reaches a certain point. Not at PACE.
Here, we're allowed to continue with the person and work with them in their maintenance program. So a person will achieve their goals of being independent and fall free, but they can still come in and use all the equipment in the gym and work with our staff, and we can keep a close eye on them and make sure they're still exercising and staying at a high level.
The team's freedom to be creative in meeting participants' needs sets PACE apart from other programs.
There's not paperwork to pass through, and there's no approval process from a higher group. It's all based on what individuals need. What is their need to keep that person living in the community? And that's how our decisions are made. That's on every level. The decisions are made at the level of those who take care of them, by the people who are taking care of them.
Tell me if you feel okay. If there's any, you feel bad, let me know.
The flexibility of PACE permits the program to do more for less money than it typically costs Medicare and Medicaid to provide care to frail elders. That's accomplished in part by keeping PACE participants healthier and out of hospitals and nursing homes.
It's well seated over.
Because the PACE team can respond rapidly to any changes in a person's condition, they're often able to prevent problems from becoming more serious. Close monitoring of participants' medication use also helps.
We even have them come in the center every day to make sure they take their medicines. And their medical problems, which used to be very complex, become very simple. And their medical issues become very much smoothed out. So they no longer are spending time in the hospital, spending time in the emergency room.
In addition, PACE participants can see a doctor as often as necessary without being rushed. Thanks in part to such individualized attention, satisfaction rates among PACE participants and their families are very high. So is the quality of care, which is constantly being monitored from both inside and outside the program. The emphasis on quality has helped spur the growth of PACE, which began more than 3 decades ago at Onlock Senior Health Services in San Francisco. Since then, dozens of other communities have adapted the model to meet the needs of their particular populations.
6 of the big one.
And now the program has permanent provider status from the federal government, setting the stage for further expansion.
So we're now at a place where we can have PACE become a household word, so that it becomes an automatic thought and consideration when someone is in a position where they're seeking long-term care services.
Services that fill the final years of life with a sense of independence, dignity, and purpose.
All of them are beautiful, and I'm a very happy person.
It's just absolutely a wonderful program.